Hi everyone, today we'll be covering the role of a pharmacist. Before we get going, let's do some introductions. My name is Allie and I'm a student pharmacist, and today I'll be bringing to you the role of a veterinarian pharmacist, and I'll be taking you on a site visit as we go and care for farm animals.
Hi, my name is Will and I'm also a student pharmacist. Today I'll be playing the role as a community pharmacist, and the activity I will take you on is filling prescriptions.
Hey, my name is James, and today I will be showing you the role of a long-term care pharmacist. I will be showing you the filling of a script from start to finish.
Hey, my name is Vio and I'm also a student pharmacist. Today, I will show you the role of a hospital pharmacist, and in my activity, we're gonna compound pills and make it into a solution.
So there will be three main ideas that we'll go over today. Who is a pharmacist? What are the different types of pharmacists? And how do you become a pharmacist?
First, let's talk about who is a pharmacist. It's sometimes forgotten that pharmacists are doctors. Pharmacists go through lots of schooling to become medication experts, and we work with doctors and patients to provide the best medication to help heal your illness or sickness.
Next, what are the different types of pharmacy? So as you know, today we'll be going over long-term care, community, veterinarian, and hospital. But there are many other different types of pharmacy as well, such as chemo, clinical, research, and nuclear. But the sky's the limit for pharmacy.
So we know that the answer to the question, who is a pharmacist and what are the different types. If you're interested in becoming a pharmacy, there's multiple ways you can go about this. You could go to an undergrad school and then go to pharmacy school, or you could pick a college like St. Louis School of Pharmacy that takes you on a direct path to become a pharmacist. Now let's dive deep into each of these topics.
Hi again. Let's talk deeper about the role of veterinarian pharmacy. As a veterinarian pharmacist, you work with animals that are sick or injured to try to heal them and make them better. As a veterinarian pharmacist, you can work in a few different spots. Most people would work in a specialty pharmacy for veterinarian, or even at a zoo. One of the responsibilities you have as a veterinarian pharmacist is making the medication and administering it to the animals. Today I'm going to take you on a track to where we go and visit a farm animal and give vaccinations to goats. Follow along. Guys, today we're getting ready to do our vaccinations to these goats, so let's give them a treat and give them their shots. So watch out. There you guys go. And then watch, you gotta make sure you get them right in the right spot like that. And then right here. Don't get it in the bone and right in the muscle there. So there they're good to go.
Hello, my name is Will and I'll be showing you the community pharmacist. Most of you know a community pharmacist. It's someone who works at a retail store such as Walgreens, CVS, or Schnucks. I love being a retail pharmacist because I have a face-to-face interaction with patients, and I get to counsel them on how to take their medication, and I get to actually fill their medication. So let me show you how I fill medication for a patient. So today, we'll be filling medication for someone, and they need 30 pills. So I've already poured some pills out, but one of the jobs that a pharmacist does is it checks to make sure that they have 30 pills for the prescription. So what we do is we count the medication. Most pharmacists, like myself, like to count by fives. It makes it easier and faster for us to count them. Let me show you how it's done. Okay, so that's just a kind of brief and fast way to show you. So next what I'll have to do is I'll have to pour it into a vial. This is what most of you know when you see a prescription. Already on there is a label. So on the label is the patient name, what the patient's going to be taking, and then how they're going to take it. So on here it says, take 1 tablet by mouth every night at bedtime. So this just tells the patient how to take the medication. So let me pour this in here. And when you're ready to check out, most of the time the pharmacist will put the prescription in a bag, just like this, and they'll staple a receipt and some information about the medicine in the bag along with it, just like this.
Hey guys, my name is Vio and today I'm going to describe you and teach you what the role of a hospital pharmacy is. So the one thing that separates hospital pharmacy is you don't really necessarily talk to patients like directly, but you do talk to doctors and nurses. We work together as a team to come up with the best plan or the best way to help the patient. So together we talk about the medication and how this, or what kind of medication and what form of medication we'll give to the patient. So if a patient is a child or someone that's unconscious, we turn the medication, or like a pill or a tablet or a capsule, into a solution so they could drink it instead of having to swallow. Or even if the pill is too big, it might be better for someone to have a solution instead of a tablet. So right now in my activity, I'm going to show you how a pharmacist in the hospital setting makes a solution. But keep in mind, in hospital, we have gloves on, and everything is sanitary, because that is a really important aspect. Right now, I'm just going to use some nerds, some candy, and then make this into a solution. So first, you get the medication, you count it, how many tablets there are, and then you pour it into the mortar and the pestle. And then you crush it up, and you kind of want the medication to be a fine powder, and everything to be nice and even. Yes, it does take some arm muscle. Yes, it is kind of hard, but over time you will get used to it. Right now, it's really hard because these are not actually tablets, but you slowly just start crushing everything, and then once you have everything crushed up, you get your solution bottle. This is water. It just depends on what drug you have, and then you pour it into the solution. Over time, you can just let it sit there depending on the drug. You can just let it sit there and shake it. And then once the drug is dissolved completely, you can transfer it into a vial, and it should look like this, the end product. And then you put a label on it with the person's name, and then how often to take it and what the drug is, and the date it expires. And that should be all for your compounding.
Hey, so now we'll be moving on to long-term care pharmacy. A long-term care pharmacy is one that will care for your grandparents. As a long-term care pharmacist, we will receive information about medication a patient needs, and we will be filling it and delivering it to them. Follow me as I show you a demonstration of this. Welcome to my pharmacy. I work at United Scripts, which is a long-term care pharmacy that supplies many nursing homes around the St. Louis area. Here's a tour of our place. So here I'm ripping off a script for the medication. There's nothing on it, obviously, since this is all for demonstration purposes. And here I am getting prepared to fill the medication. As you can see, I'm wearing gloves since we all have to be sanitary in the pharmacy. Now you can see me as I get prepared to heat seal the bubble package. I'm making sure that there is only one tablet in each bubble. As the bubble package comes out of the heat sealer, I'm getting ready to apply the prescription label, which will include things like the name of the patient, the name of the drug, and instructions on how to take the drug. Next, you can see my pharmacist, Dr. Weishar, verifying that the medication was filled properly. Here I am back in the toting area, making sure that the medication goes to the correct home. Day, as we are preparing to ship out all our medications, we place all the medications into brown paper bags such as these. We make sure to staple it shut so no one can access them except for the home. And then we also placed a sheet of paper called a manifest, which allows the home to see if the proper medications are in the bag or not. And that's all. Thanks for watching.
Hey, now that you've seen a glimpse of into the pharmacy practices, we should recap our session today.
Let's remember the three key concepts that we were going to discuss in today's lesson. The first one, who is a pharmacist? The second, what are the different types of pharmacies? And third, how do you become a pharmacist?
Let's see if you can answer some of our questions. Who is a pharmacist? If you answered a doctor or a medication expert, you're correct.
Next, what are the different types of pharmacies? If you said hospital, long-term care, community, or veterinary, you are correct. If you also said the other types I mentioned, you are also correct. And remember, there's many different types of pharmacy that I have not listed as well.
The last question is, how do you become a pharmacist? So there are a lot of ways one can approach the situation. You could go to an undergrad college and then go to a college of pharmacy, or you can pick a school like St. Louis College of Pharmacy and be on the direct path of a 7-year program to become a pharmacist.
Remember that there's a worksheet that you can complete after this to check on your skills and see what you've learned today. Thanks for watching.
Bye.